So what about pain? Well, pain is a complex situation, if you will, but one of the things that's been associated with chronic pain is low vitamin D3 levels in people. And D3, we all think about the skin and sunlight being important. However, in order to convert to the active form that your bones and all of the tissues in your body can use, because remember, or maybe you don't remember, but almost every cell in the body has a vitamin D receptor. Just like thyroid receptors are all over the place, so are vitamin D3 receptors. But they only respond to the active form of the vitamin, and you need a healthy liver and a healthy kidney to get there. So there's a certain number of steps that take vitamin D, which is a cholesterol molecule, and the liver is very important in manufacturing fats and cholesterol. So vitamin D3 has to be converted through different hydroxylases or enzymatic reactions to get to the active form. And so the liver, which is involved in cholesterol synthesis and also involved heavily in protein synthesis for like enzymes, if that goes down on top of hepatic osteodystrophy, then you have less vitamin D3. And then what that means is you're more susceptible to joint pain and joint problems. So one thing I see in my clinic a lot, people with vague knee pain or joint pain after they've started working out or whatever, you get an MRI and you see all of this signal in the bone, but there's no true fracture line, but it's just bright, meaning there's a lot of fluid in the bone. What we found is that that is highly associated with low vitamin D3 levels. So if I see that on MRI, I automatically check their vitamin D. Because if you supplement with vitamin D3 in that setting, you can get rid of that soft tissue intolerance and that subchondral stress or that stress in the bone that causes the signal change on MRI. So we see this all the time in orthopedics. So not only do you have changes in steroid metabolism, which steroid is, part of that whole cholesterol pathway, you also have changes in the activation of the D3, and then of course the hepatic osteodystrophy we already talked about. And then there's some medications that people take when they have liver problems that further make the problem worse. Proton pump inhibitors are highly associated with osteoporosis and stress fractures. Exogenous steroids that people take, like estrogens and testosterones, and then diuretics that people take. And a lot of the diuretics have you urinate out minerals that further deplete your bone and tissue health.